Well, good morning, everyone, and thank you for joining us today in Howard County as we discuss a vital step toward moving forward in our mission to make healthcare accessible for all, especially our young adults right here in Maryland. I'm proud to stand here once again to discuss the Young Adult Health Insurance Subsidy Pilot Program, a groundbreaking initiative that brings us closer to ensuring that no young person has to go without health care simply because of its cost. This program, established through the leadership of Senator Brian Feldman and Delegate Ken Kerr, is a remarkable effort that addresses a critical gap. With nearly 25% of young adults in Maryland previously uninsured, this program steps up where it's most needed, making health care affordable and within reach for those between the ages of 18 and 34. Supported by $20 million over 2 years, this initiative will help reduce healthcare costs for Marylanders of all ages. Moreover, we are making an impactful investment in health, stability, and the future of our young adults. This program specifically addresses health equity, targeting racial and ethnic disparities that have left far too many of our young adults without access to the care that they need. And by providing substantial financial assistance, this program is ensuring that health care becomes a reality for more of our young adults who are often left out of Medicaid eligibility or have struggled to afford private insurance. Eligible participants can enroll in plans through the Maryland Health Connection with premiums as low as $1 a month, down from an average of $70. This opens the door to comprehensive coverage that includes everything from preventative care and prescription medications to mental health support and emergency services. For some, it may even mean the difference between receiving timely care or foregoing necessary treatments. The best part is that we know that our Young Adult Health Insurance Subsidy Pilot Program actually works. Since its implementation, enrollment has seen tremendous growth, with our young adult participation rising by 20% in Howard County alone. Across the state, over 67,000 young Marylanders are now enrolled, including more than 22,000 first-time enrollees. This is not just a statistic, it's a sign of progress toward a healthier, more equitable future for all. I want to thank our partners at the Maryland Health Connection, Senator Feldman, Delegate Kerr, and all those who have tirelessly advocated for this program. Their work and dedication are setting an example for what can be achieved when we come together to address the real issues facing our residents. And as we look ahead, our goal is clear: to extend this program beyond its initial expiration, keeping health care affordable for our young adults, and lifting the financial burden from those who need it the most. Together, we are building a healthier, stronger Maryland where every person has the support and care they need to thrive. I want to thank everyone for being here today and for your ongoing commitment to health equity, community well-being, and let us continue this work and create lasting change for future generations. It's now my honor to introduce a friend, a leader, a champion, someone who has been doing this work well before it was popular and who continues to be on the front lines of ensuring that every Marylander is seen, is heard, and has their very best opportunity to live their healthiest life, embracing wellness. The unparalleled Vinnie DeMarco.
Thank you, Mr. County Executive. Let's have a big hand for County Executive Calvin Ball. Thank you for your leadership, County Executive, in Howard County and in the state. And together we are making Maryland a better place. The Young Adult Subsidy Program is a tremendous success, partly because of the leadership of people like County Executive Ball and also our legislators, and our terrific exchange, which I think is the best in the nation. And you're going to hear today how successful this program is and how critical it is that the program be continued. We're going to hear first from another County Executive Stuart Pittman, who with County Executive Calvin Ball was right there from the beginning in getting this law enacted in 2021 and has been there constantly to make sure that this law is fully implemented and works, and is here to urge its renewal. County Executive Pittman?
All right. Thank you. It's great to be here in Howard County, from the best place for all, Anne Arundel County. We have a little competition going, and that's a healthy thing. But I know that County Executive Ball and I are not the only county executives who are in support of this extension of this pilot program. This is really, really simple stuff. If we don't continue to help our young people aged 18 to 35 to get into the exchange, the rates will go up for the rest of the people in the exchange. So it's the young people who often don't get insurance because either their employer doesn't provide it directly, or they just feel like they're not vulnerable and they're not going to get sick and they're not going to get hurt. So they end up uninsured. We need to get them in. We've got 5,500 young people in Anne Arundel County who are participating in this program, over 60,000 in the state, and it's important for the taxpayers to understand too that this is not money that is coming from them. This is money that is coming from an assessment that the insurers pay anyway. And continuing this program and extending this pilot that has been proven to be successful for future years is absolutely essential. And I want to thank Senator Feldman for getting this thing started, and for Senator Lamb, who's going to be taking the ball and carrying it through this year in the Senate. We've got to get this done. This is the least that we can do to ensure that our residents have the health insurance that they need so that our economy can be strong.
Thank you, Senator Pittman. Howard County and Anne Arundel County can be very proud of their wonderful county executives. Other county executives are very supportive, as County Executive Pittman said, but they couldn't make it. County Executive Angela Alsobrooks, who, as you all know, was elected to a new position as our senator-elect, which we're very proud, couldn't make it, but sent her wonderful Deputy Administrative Director for Health and Human Services, Dr. Sanmi Arioli. Sam, Doctor?
Thank you, Vinny. And I join the county executive in saying that every community needs somebody like Vinny. He does so much work for the community, really behind the scenes. County Executive Angela Alsobrooks sends greetings, very, very much in support of this. Here's what we know: the more people we get insured, the better our health outcome will be. And so when we see a program that's this successful, that's proven to get people insured, that's really relatively inexpensive for a county like ours, where we have an estimated 60,000 residents uninsured. What we want to do with those numbers is to bring them down, not to add to the pool. So this program works. We like it in Prince George's County. It's been very impactful in our county, and we're very much in support of this program. Thank you.
Thank you very much. Please give our congratulations to County Executive Alsobrooks. Okay, and you know, this bill was enacted in 2021 thanks to the leadership of Delegate Ken Kerr and Senator Brian Feldman. Delegate Ken Kerr can't be here today, but sends his regards and really promises that he will push hard to enact this in renewal in 2025. The bill was enacted in 2021 as a 2-year program, and in 2023, Delegate Kerr and Senator Brian Feldman, the lead sponsor in the Senate, got it renewed. We are thrilled that in 2025, when the bill is up again, Delegate Ken Kerr will be the lead sponsor. The lead sponsor in 2025 will be the wonderful Senator Clarence Lamb, who is a great leader of public health, a doctor and a public health leader in our state. Senator Brian Feldman will be one of his co-sponsors, as well as Senator Antonio Hayes. I'd like to call up now Senator Clarence Lamb and Senator Brian Feldman to talk with you about how important it is to get this done and how they will work to get it done in 2025. Senators?
Well, first, let me apologize for I didn't get the memo on the requirement that all men wear ties here today, and so. Okay, first of all, it's great to be here with my Senate colleague, Dr. Senator Clarence Lamb. a real leader in healthcare, as well as our two county executives, Calvin Ball and Stuart Pittman, also have been out front on healthcare policy for quite some time, real leaders in this space. I also have to say that a lot has been written over the last several years about how Maryland has been taking the lead in terms of innovative strategies to increase access to health care. So I do have to join the chorus in giving a shout out to Vinnie DeMarco, who's been in the middle of a lot of those initiatives that come out of the Maryland General Assembly over the past few years. If I might just kind of to refresh everybody's memory, we had, among other things, the first in the nation easy enrollment program. If many of you recall, you check a box now on the Maryland state income tax return, and it, basically that information, your financial information, is shared with the Maryland folks like Michelle Eberly, and they decide if you're eligible for Medicaid or maybe eligible for some federal tax benefits that you didn't even know you were entitled to. That was first in the nation. Other states have modeled it. Similarly, a few years ago, we passed the first in the nation Prescription Drug Affordability Board, which several other states that had to do with the problem of high-cost prescription drugs in this nation. And so again, a litmus test, a model for many other states. And in fact, this session, we're going to be bringing in a bill to expand the authority of the so-called PDAB. And so keep an eye on that, which brings us to today. It was great to collaborate with Delegate Ken Kerr a few years back in 2021. Another really innovative idea having to do with the adult subsidy pilot legislation, which not only did we pass the pilot, we then backed it up with $20 million per year through 2025 to provide health care subsidies for our lower income young folks, 18 to the mid-30s. And it's been referenced already how important that is. It's not just that 67,000 young folks have taken advantage of the subsidy to get health insurance. It's just we really need that group in the insurance pool. These are the folks who think that they're going to live forever, never get sick. And in insurance, the way it works, of course, is you need young, healthy folks in that pool to bring down the costs for everybody else. So I'm super excited to be handing the legislative torch this session off to Senator Lamb to take this program from 2025 in its current form, extending the program to 2028. And then finally, none of this would work if Marylanders don't know about the program. And so one of the reasons we have a press conference here today is to help get the word out about the program and about the bill that's going to extend the program. And with that, I want to thank everybody for being part of this today, and I'm going to turn it over to Senator Lamb for a few minutes.
All right, good morning, everyone, and I want to extend our appreciation to Vinnie and so many others here who helped bring this to fruition and continue to make this happen. And also to Senator Feldman, it was really his leadership along with Delegate Kurz that was able to have the vision to see this pass a couple years ago. This young adult health insurance subsidies pilot program. I don't know if, Vinnie, you could have made that title any longer. It would be nice just to drop pilot program. If we could do that, you know, that would be great. Because I think we see the benefits from this important program, and that's why we're here to renew it, you know, and I appreciate Senator Feldman's willingness to kind of pass the baton here, and we'll help champion this along with Delegate Kerr to make sure that this is passed this session, because this is incredibly important for our communities. And it's a win-win. It's a win-win in so many different ways. As the only physician in the Senate, we know that it is important to get as many people covered under health insurance as possible. It not only helps our patients that we see, but it also helps our entire community. As Senator Feldman and others have pointed out, by getting more people insured, this helps subsidize and bring down rates for everyone, because we are all paying for people that end up in our emergency departments that need urgent care or emergency care, and we're subsidizing that through the rates that we're paying. By getting more people insured, we're able to help bring those rates down. And it also helps those young people. When you hear that tens of thousands of Maryland youth have been able, young adults have been able to enroll in health insurance in just the last few years, it's really remarkable when you think about the fact that in 2021, we saw tens of thousands of young adults who were uninsured. And so this program has made tremendous strides in being able to bring those folks under health insurance to have access to care, which is incredibly important. And it's also important because we recognize that particularly for young people, the type of conditions and illnesses that young people have tend to be even more expensive in that age range proportionally, because a lot of these folks, they may get injured from car accidents or severe significant illnesses or genetic disorders or conditions that have significant outlays of funding that are required to be able to support them, provide the level of care that they need. And so, you don't want to have someone who's young having a catastrophic car accident, ending up in the ICU for weeks with no ability to pay for that and no health insurance at all either. And so in so many ways, it's a win-win. It's an assessment, as was mentioned earlier, that is has been supported by the health insurance companies, where for the last few years, as they've paid to have something called reinsurance, which is a backup insurance plan for a lot of these health insurance for any catastrophic payouts that might occur, this is a fee that's assessed on the health insurance companies to help support this really important program. It already exists. This fee is already being assessed for the health insurance companies, and we just want to extend that to make sure that this phenomenal program has the ability to continue on, not just for a few years. Hopefully, fingers crossed, we can drop the pilot program at some point and make this a permanent program as well, so for so many Marylanders who need it. So I want to thank everyone who helped with so much of the effort to bring the legislation forward to this point, to get previous legislation passed, and the work that continues that we'll be sure to put in for the next few months to ensure that this program can continue to serve Marylanders as well. So thank you so much, and really appreciate all the effort from everyone behind me. I'll turn it back to Vinny.
Thank you, Senator. Thank you, Senator Dr. Lamb. We appreciate it very much. And the legislature heard from many people, and one of the groups that really made a big difference was the support of the Maryland Hospital Association. I want to thank Andrew Nicholas from the Maryland Hospital Association for your support in the past and your continued support in 2025. But probably the most important people to testify before the legislature were people whose families benefited from this law. And we're thrilled to have with us today Jana Varwig and Sarah Burr, who will tell you how this law has helped their families. And it's something we all need to listen to, because it shows us how important, how critical it is that this program be extended in 2025. So I'm now going to turn over the mic to Jana and Sarah.
Thank you, Vinny. Before the state enacted the Young Adult Subsidies Program, many young people working for small businesses, small nonprofits, or doing gig work did not have access to affordable health insurance. My son is a case in point. Like many young adults, he's working for a small employer within the food industry who does not offer health insurance. So prior to the youth subsidies program, my husband and I said to my son, "You must have health insurance." So he reluctantly found a policy on the Maryland Health Connection that provided some very basic medical care. However, it had a very high deductible, meaning that he would be responsible for paying most of his medical costs up to $6,000. If he had become seriously ill or injured in an accident of some kind, he could easily have incurred that $6,000 worth of medical debt. That would have been unaffordable for him and for most young adults in entry-level jobs. Moreover, and I think this was an important piece of the story, is that he was hesitant to use the health insurance he had bought. He was afraid that he would have medical debt, and so he didn't go to the doctor when he needed to go to the doctor. And this concerned us very much as parents, and lots of parents are concerned about this. When the Young Adult Subsidies Program came into being, however, my son found another policy at our urging that had a much lower monthly premium and a much lower deductible of around $2,000. And it offered more medical services. With this insurance policy, at an affordable cost, suddenly he was going to the doctor when he needed to go. And this, of course, was something that relieved us greatly. As a retired university administrator, actually a dean of students, I know that as healthy and invincible as young adults believe themselves to be, things do happen. They need affordable access to preventive health care and medical services. I've talked with many parents of young adults without health insurance, and I can tell you this is an issue that really concerns parents. Please support this very important program.
Everybody who's a parent in this room knows that when your kids become young adults, you still really are concerned about their well-being. When my son aged off the Affordable Care Act, age 26, I was terrified. What is going to happen in terms of health insurance? Unbeknownst to me, the Maryland Youth Health Subsidy was already in effect. We went on to the exchange, which was really easy to use. He was at that point also working in food service, making minimum wage. It's really hard to live on minimum wage. And we were able to find good health insurance that covered the issues that he was facing medically at the time, and at a price that he could afford. So this program is vital. My son is one of the 67,000 young adults that have benefited from this program, and I surely hope that we have the wisdom in Maryland. Maryland is a special place right now, that we have the wisdom in Maryland to preserve health insurance for the young adults that need it. Thank you.
Sarah, for those very powerful statements. So our program works because our legislators, Senator Feldman, Senator Lamb, Delegate Kerr, got it enacted. And the county executives worked for it, and you heard people who benefited from it. But the reason it works is we have the best health benefit exchange in the country, bar none. And that's largely due to the tremendous leadership of Michelle Eberly, who is a hero to us in Maryland and around the country. And we're thrilled at how well she has implemented the Easy Enrollment Program that Senator Feldman talked about, so many other programs, including the Young Adult Subsidy Program. And we're thrilled she's here with us to really tell you how that program works and why we need to keep it in place. Michelle?
Thank you, Vinny. Vinny always says we are the best in the nation, and I will say it's because of all the participation you see behind me today. Vinny, I say all the time, is our #1 cheerleader, and we need those cheerleaders. We're just so fortunate in Maryland to have the legislature that we have, and under Senator Feldman, Delegate Kerr, now Senator Lamb, and Senator Lamb has been a huge supporter of many health care things that the exchanges worked on. But because in Maryland we are always forward-thinking and looking at how can we continue to get more people covered in the state of Maryland. And then through our county executives who really are, again, our tentacles out into the community, who welcome the exchange to come in and participate and help us to communicate to get folks covered. The Young Adult Subsidy Program has been hugely successful. You've heard all the numbers, but what's most important, and we've done a lot of work around this, we've done a lot of work around finding where the young folks are, what's going to appeal to them in terms of, several years ago we started using WhatsApp, advertising on certain social media that, I'm not familiar with, but young folks are familiar with. And it's been very successful, all those collective efforts. We have such, I think 30% now of our total enrollment, which is well over 200,000, are young adults between the ages of 18 and 37. That, as you heard, has made the whole risk pool very healthy, which reduces premiums. So when the carriers looked at what are they going to charge, they look at their medical trend, they look at what's called morbidity, what does our pool look like, and they see all these young, healthy people. And they're like, wow, we can lower rates for everyone. So that's been very successful. Again, in Maryland, the fact that we have a reinsurance program, we still, and I think we're 3 or 4 years running now, have the lowest bronze plan and the lowest gold plan in the nation. So that's for everybody. So we can't lose sight of the health care that we're providing for many Marylanders. And then I'd be remiss if I don't, again, educate folks on the wellness and preventive measures that are afforded through the Affordable Care Act. Used to be, I like to say, we used to buy health insurance because we did not want to have a financial catastrophe in our life. We didn't want to go bankrupt. Well, now, you can prevent those significant illnesses through free immunizations, free mammograms, free colonoscopies, a lot of screenings, things to keep you healthy. At the exchange, we've designed our plans to target medical needs that are important to our state, such as diabetes, and in fact, that reinsurance program, which helps pay for those very high-cost claims, we've seen the costs associated for diabetic care and diabetes in our state go on a downward trajectory. Since we have done a lot of the efforts around making sure our plans provide the test strips, the insulin with a capped premium, or capped copay. So it's no longer a catastrophic issue to have health care. It keeps you healthy, it keeps you well, it keeps the state healthy and well, it improves our economics in the state, we keep people working, we have a lot of people, as you've heard, young people that have started their own businesses. I think coming out of the pandemic, I heard that Maryland had 40% increase in small businesses, many of those women-owned, and many of those are young entrepreneurs that really want to start their own businesses and are getting zero cost, low cost, very affordable health coverage through Maryland Health Connection. So this is a critical program. We are all committed to it. And the exchange would not be what it is without the support of everyone behind me and the legislature that does such good work on our behalf, our governor that does such good work on our behalf. So we are thrilled to see that this will continue, which is our hope and desire beyond 2025.
Thank you so much, Michelle, and thank you for your leadership. We also thank Governor Westmore, Lieutenant Governor Runa Miller for making quality, affordable health care for all a priority for them. And again, we at the Maryland Healthcare for All Coalition make it one of our top priorities in the 2025 session to continue this life-saving program. We work closely with many groups, but the most important of which are the faith community, which has made its voice very clear in support of this. And I want to introduce Reverend Sandra Connor, the first woman president of the Baptist Night Ministers Conference of Baltimore and vicinity, to close us out here. Reverend Connor.
Good afternoon, everyone. Well, it's still morning, so good morning to you all. I want to first of all thank all the folk that are behind me and those of you who could not be here today, but I also want to thank those of you who might be listening to this or you may hear going forward. If it were not for you all going behind the scene to do what you do, to write the letters or do whatever to support the bills and things we do to push this forward, even to get people to sign up, it would not be a success. So right now, I want us to give you all a great big hand clap and applause for what you do. I want to also thank the fact that we have adopted as faith leaders. You're saying, well, why is this faith community involved? Well, because not only do we want a person's soul to prosper and to be spiritual, but we also want them to prosper holistically. That means everything about them. If you're not healthy, what can you really do to be successful? So our desire is that everybody might be successful, that they might have equitable health care, that they might be to move forward. If you got social determinants of health, you cannot move forward. You cannot do anything from A to Z. So that's our desire as a faith leader. We expect us as faith leaders to get engaged and be involved because, first of all, we're the trusted people. I hate to say it, but that's what they say we are. The people come to us. They come to our churches. And so I'm appealing to those of us who are out there who are in the faith community, those of you who are in this room, those who may be listening, to take this message. Go take it to your brothers and your sisters. Who's your brothers and your sisters and your neighbors, whoever you may see. Appeal to the young folk, get them engaged, get them involved, that they might too get others to sign up for this important insurance. Folk don't know about it. If we don't share it, they won't know. Often we come to meetings like this, press conferences, and we don't take the word out. It is our duty to take the word out that somebody else might benefit from what we're doing and how we're moving forward. I applaud you for what you're doing here today, the fact you took time out of your busy schedules to be here. If you even click us on late night or whenever, I thank you for doing it. But nonetheless, we want you to continue on. We've been having different sessions at Healthcare for All, Zoom meetings and face-to-face meetings to share this information. I want to announce that this coming Saturday at 10 a.m., there's going to be a special meeting that we're having that you might go to healthcareforall.com to get the link to sign up. We also want you to spread the word. Tell somebody else that at 10 o'clock this coming Saturday, you'll not only hear more about this particular initiative, but you hear more about Healthcare for All. We want everybody to be in good health, because when you're in good health, you can move forward and you can contribute. You can be the great person that God wants us to be. Thank you all.
Thank you, Reverend. That was beautiful. I'm glad Reverend Connor mentioned the Zoom on Saturday at 10. Michelle Eberly will be on it, Nellie Washington, the head of the Health Equity Resource Communities, and a wonderful new Insurance Commissioner, Marie Grant. So we encourage you to go to healthcareforall.com to join that. So we're about to close out. I know there are media folks on our Facebook live stream. If you have questions, you can email them to me, and I'll get it to the right person. Is there anybody in the room with a question? Media, anybody? Okay, with that, nobody leaves without a picture behind the banner. So thanks, everybody. Thank you, Mr. County Exec, for hosting.